Florida represents more than 250 mission-driven communities, representing more than 500 total facilities across the state. And we represent the entire continuum of care that you've heard some about so far this afternoon. Affordable senior housing, continuing care retirement communities, assisted living facilities, nursing homes, and home and community-based service providers. We could not be more happy to be here today joining AARP and the Florida Healthcare Association in this important coalition, as you've heard already, to develop short and long-term strategies to meet the needs of Florida's seniors. Providing the highest possible quality of care for seniors in the coming decades, as you've already heard, is an increasingly complex, multifaceted challenge. And any solution is going to require an equally complex set of responses. You've heard the statistics, they don't need to be repeated. 1 in 4 Floridians age 65 and older by 2030. Meanwhile, seniors who need nursing home care tend to be older when they arrive in a nursing home than they have been in the past, and they too have more complex healthcare needs. The men and the women who care for these residents are the backbone of any nursing home. We're talking about nurses, certified nursing assistants, therapists, and others who provide the care and assistance with the activities of daily living that seniors need assistance with: bathing, dressing, feeding, and others. And we are joined, I noticed, by many of them here today. Thank you for being here. You've already heard Maryland did an excellent job, but it bears repeating. Florida's nursing homes offer among the best long-term care in the nation. And that care continues to improve thanks to the dedication of these professionals who are with us today. But long-term care providers are also struggling to meet the need of caring for a larger, more complex senior population. We're in the midst of a severe and deepening workforce shortage, and the projected increase in older adults who will need care in the coming years increases the urgency of the need for solutions. In the short term, the solution is to provide adequate funding for long-term care and home and community-based services providers. In its simplest form, funding supports staffing, and staffing drives quality. Without adequate funding, hiring and retaining the specialized staff necessary to ensure quality care will continue to be a significant challenge. So we join our partners today in asking the legislature to once again properly fund nursing home care, to support seniors across the entire continuum, and to ensure that their access to long-term care is available in the most appropriate setting with the highest possible quality outcomes. In the long term, we believe a new approach to planning for and delivering care to Florida's seniors is needed. Fundamental change and continued progress toward high-quality services and supports for seniors will require all of us to work together to find common ground and to advocate on behalf of the people who need that care. We believe it's time for a new path forward, one of close collaboration between providers, policymakers, regulators, and seniors. Thank you for being here today, to help ensure that providers can deliver the quality of care that Florida's older adults need and deserve. Thank you very much for being here today.